we
Well,
can.
Okay, great. So thanks very much for this opportunity to present. And we've got a kind of a standard presentation. I think we've already had the opportunity to engage a couple of times already, since our projects are somehow related or have dependencies. But I think this is more kind of the generic in presentation around PharmaLedger, and without further ado, I'll turn it over to Xenia, who is going to start the presentation.
Hello, good afternoon. Can you hear me?
yes, good afternoon,
Yes.
Sanya.
Hi. Okay, so then you need to move a little bit the slides. Okay, so what we are going to present today, as Dan said, is a standard presentation, but we want to get first, okay, what is PharmaLedger, who we are behind PharmaLedger, what are we doing, what are our plans, and what is our roadmap, so you know actually how we're working, and you know better the project. So what's PharmaLedger? Okay, so actually we started in January this year. Okay, and what we are doing here is called blockchain-enabled healthcare. So we're doing architecture of blockchains, okay, to support, okay, trust and actually, let's say, exchange of records in the areas of healthcare, in the areas of supply chain, and in the area of clinical trials as such, okay? So our blockchain platform is scalable, okay? And it will be scalable through the different use cases and that are in this, what we call DRAs, which are the reference, okay, architectures, okay? And in the three domains I commented. So our main goal and how we want to do it, okay, is that we really want to design and validate this platform, okay, to really provide the delivery of innovative, what is called sovereign applications across the pharmaceutical industry and the healthcare industry as such, so we can link them and create, okay, governance that really will go and take PharmaLedger project and the architecture behind PharmaLedger in a sustainable manner to the market later when we finish. So our project has a budget of 22 million right now, and we are 29 partners that are behind PharmaLedger that we're going to present now. Next, please. So this is a PharmaLedger consortium. We have 12 FPM members. There's pharmaceutical companies, okay? Our members, okay, are spread and after that, okay, we have 5 small SMEs. They are highly specialized. Most of them are blockchain specialists, okay, or in the area of ICT and platforms. We have 4 research centers, okay, that are actually applied center, most of them. We have KO Leuven, which is our legal partner. We have 2 patients organizations. We have a government authority, okay, that is coming with a traceability technology behind it. We have 1 CRO and 3 hospitals participating in PharmaLedger. We cover 10 member states plus Switzerland and Israel and the United States. Next, please. So these are our objectives, okay? The first thing is that we are healthcare enabled, blockchain healthcare enabled, okay? And we want to actually empower patients, okay, through these sovereign applications. And we want to be able to give the patients, okay, the rights and the power to really say if their data could be used or not used through the blockchain and register that. We also want to register and trace, okay, products and maybe services through the supply chain, okay, and provide transparency for that. And we really want to get efficient in the clinical trials, so we are able to do traceability and provide data provenance, okay, and digitalization through the clinical trials area. So for this, we have a legal framework that really supports that, okay? We want to formalize the data and interoperability of data for this. With blockchain, we support security, And on the other side, you know, we would want is to integrate the data from these three areas or the arrays, okay, to really provide an agile and secure delivery of the outputs for this. Our blockchain enabled is privacy enabled and confidentiality enabled. So next, please. So we have three types of stakeholders interacting with the blockchain in PharmaLedger. So we have the applicant consortium, which has all the mix that you saw before, but we are also extending, okay, to external partners, either in the R&D area or supply chain area, and for sure all the EPIA and IMI partners coming for this. So I let you the floor, Dan.
Thanks, Anya. So the original name of the project as it was proposed, the topic text was blockchain-enabled healthcare, before we got a cool branding name of PharmaLedger. But the question is, what is blockchain-enabled healthcare? I'm not sure that we know, but we have you know, some ideas around that. And basically, you know, it's not just the three domains that we're talking about within PharmaLedger: supply chain, clinical trials, and health data. There's certainly other domains. There's the payments, healthcare providers, electronic health records, research, drug. So there's many other components to this. And of course, as Zania mentioned, we're focusing on specifically on one. So we just use this slide to kind of explain what we envision at a very, very high illustrative level about blockchain-enabled healthcare. And we use this kind of view to explain really what the scope of the project is. So I mean, we're focused on these three domains or domain reference applications: supply chain, clinical trials, and health data. We are to deliver a reference implementation for one use case in each of those domains, enabled or underpinned by a common blockchain platform. So we recognize that, so we want to do at least one use case. We're actually a little bit ambitious at this point and have more than one prioritized for each of the domains. But we also recognize that PharmaLedger is not the only show in town here. There's a lot of other initiatives ongoing, and we believe that ideally there can be some convergence between the different initiatives, which would increase the value of the solutions and minimize this whole topic around interoperability or lack of interoperability. I think that we've seen that blockchain is not the traditional software solution business model where you have one solution and they gain market share. I mean, the idea here is that the more participants that join a solution, the more value that it creates. So we don't want to leave value on the table by not enabling interoperability or not trying to realize some degree of convergence in the solutions. This is the roadmap. As Zania mentioned, we kicked off at the beginning of the year in Prague. That was great when we still could do face-to-face meetings and conferences. That was the last one I was at. Then we spent the first 4 or 5 months of the year focused on prioritizing the use cases. The remainder of this year is going to be looking at really defining the use cases in detail, definition, functional requirements, technical requirements. So basically, and also engaging with different stakeholders, external and internal stakeholders in our organizations, that to make sure that they're aware about what we're doing and which use cases we're doing, and give them an opportunity to engage on those. And for the remainder of the project, so 3-year project, we're going to be looking at communications, change management, so education and awareness around blockchain, the governance topic. We want to ensure that the delivery, whatever we deliver, is sustainable and hopefully can grow. We want to then do some pilots, have the reference implementation, and also engage with different regulatory authorities, stakeholders, and stuff like that. And then, of course, it's all about dissemination, sharing the results, and in different ways, whether that's conferences or through our website, papers, or the such. The organization, I believe that most of these IMI projects have relatively or similar structure and everything, but this is our setup. I'm co-leading the project with Xenia from UPM. I'm from Novartis, and we have business use cases. We have kind of the applications, work package 2, which is implementing it. My colleague Marco Cuomo is leading the architecture and reference implementation. So this is actually designing and creating the platform for it. Pfizer is leading the governance work stream, work package 4. Actually, Novo Nordisk and KUL, Catholic University of Leuven, are leading the regulatory, legal, and data privacy, and Novartis and Technovative Solutions are leading culture and adoption. Three domains, and I think that basically, in terms of external advisory, technology manager, this is pretty common for IMI projects. Okay, that was our standard presentation. So be happy to take any questions, answer any questions that you may have at this time.
Thank you to Daniel and Xenia. We're open for questions, so just holler. I may want to start with one. You mentioned that one of your